እንኳን ለስምንተኛው የሀገር አቀፍ የህብረተሰብ ጤና ሳምንት አደረሳችሁ።
Jambo, karibuni kwenye makutano yetu ya miaka 8 ya wiki ya taifa ya afya ya umma.
مرحبا بكم في الاحتفال الثامن بالأسبوع الوطني للصحة العامة.
Bienvenue à notre 8e célébration de la Semaine nationale de la santé publique.
kusoo dhawaada xafladda sideedaad ee toddobaadka caafimaadka dadweynaha qaranka.
Oyei malamu na fete na biso ya 8e semaine ya santé publique.
All right. I just want to say thank you so much to everyone. I'm based here in Nashville, Tennessee. I'm not in Maine, but I would love to move to Maine because you guys always do amazing activity around the week of National Public Health Week, which we don't get to do here in Nashville, Tennessee for our community most of the time. But yeah, my name is Muna Mude. I think maybe earlier, I think there was some flyers passed around. So I think a lot of detail about my background is listed there. I think I would just keep it short, but my name is Muna Mude and I'm based here in Nashville, Tennessee. I'm originally from Somalia. I moved to the US in 2004 as a refugee. I never moved another state ever since. I completed all my studies here in Nashville, Tennessee. I have a master's in public health from Vanderbilt University with a focus on global health. In my previous work, I have worked with the CDC Foundation and the State Health Department. And currently I am the Director of Programs at the ADES Clinic, an international global health organization that is basically deploying digital health and health technology in underserved and remote communities in East Africa. So I'm very, very honored and excited to be here today. And of course, I can thank the Numena's Public Health Initiative for giving me the privilege to be here today. I'm really honored. Thank you so much.
Insecurity and its impact on health. It's so important. Thank you for joining us. And before we go to the speech of each speaker, I would love also to introduce at the same time our second speaker, Ibrahim Mohammed, who is a fervent advocate of food and nutrition issues in the community. Ibrahim Mohammed, please, would you introduce yourself briefly? Hello. Before we go to the program?
I got you. Hello, everyone. My name is Ibrahim Mohammed. I'm a program director at SLRO. It's a really small organization that started in 2015. I joined about almost 2 years ago. I'm the program director, and some of the programs we have are mostly about empowering, immigrants, integrate them into the workforce, making sure they have like sustainable living, A lot of times what I do is I'll provide transportation, interpretation, help with like grants, help them find funding, connect them with people. And then the other thing that we do is, the youth as well, I'm trying to lead the youth or give them a path to being successful in this workforce as well, immigrant youth. And then one of those things is informing them about, food and nutrition. I did like an event with them, and then it was like surprising, like how they didn't really know what the definition of food insecurity was. So it was kind of fun doing an event with them, and it feels wholesome. So that's mainly what I'm here at SLRO for, and I'm glad to be part of this Numena's Public Health National Health Week. I feel honored to be one of the speakers. So thank you guys for having me.
Thank you, Ibrahim. I remember you doing, one of the most important parts of the work during COVID when we were on the LA Task Force. So the food insecurity was the most important thing. Sorry, friend is here. Okay, thank you, Mr. Ibrahim, for your time. And so our first segment will cover understanding food insecurity and its impact on health. Overview of the factors that contribute to food insecurity, including poverty, lack of access to healthcare, food options, and limited knowledge about healthy eating habits. Discussion of the impact of food insecurity on health outcomes, including chronic diseases and malnutrition. Presentation on the importance of addressing food insecurity to promote health and well-being. And we'll pass it to Muna Mude to take over and cover that part.
And how it impacts our overall health and well-being in general. So I will be addressing these issues or topic of food and nutrition from my experience as a public health expert. And hopefully it will be beneficial to you all and the community that you all are advocating for and engaging in the aspect of this area of public health. Okay, so first let's start with what is food and nutrition. Nutrition begins with food. Nutrition is the process by which the body nourishes itself by transforming food into energy in body tissues. The science of nutrition concerns everything the body does with food to carry on his functions. Food provides an essential substance called nutrients. The body needs these nutrients to make it make energy, to grow, repair, and maintain his tissue, and to keep his different systems working smoothly. So food and nutrition are partners. They play hand in hand. If you don't eat food, you don't have the nutrition. And if you don't eat the right food as well, then you don't have nutrition as well. And your body does not gain the nutrients that it needs to basically operate as is required to operate. And I just want to say, if in case anybody have any question, please feel free to stop me anytime as well. I forgot to mention that. And so let's now talk about some of those essential nutrients that comes from both food and nutrition. So nutrients are actually divided into 6 groups. And within that 6 group, they are classified into 2 specific, a class, which is the macronutrients and micronutrients. So the macronutrients includes the carbohydrates, which is major source of energy, storages, or sugar. Then you have the fats, which also supports organic compounds for the body. And then you have the proteins, which are basic component of all body cells, building and repairing tissue, regulating body functions, and providing heat and energy. So class 1 is very important, which is basically, it does a lot of the big work in our system. It's like car basically. You cannot drive a car if you don't change the oil every 3 months or 4 months. You cannot drive a car if you don't put gas. So the way food functions in our body is also similar way. And then now you come down to some of the other smaller functions, which is the class 2 micronutrients. And these are now the vitamins, the minerals, and the water. Vitamins, all the organic compounds essential to life, metabolism, tissue, building, and regulation of body processes. And minerals are inorganic elements found in body tissues, regulate body fluids, and the body functions, growth, and building tissue. Also, water is one of the most important things. That's why oftentimes you hear water is very, very important. But what happens, like today in some parts of the world, like in Africa, refugee camps, people are drinking water with, not just in Africa, but look at Michigan, what happened with the water leak, where it caused a lot of people to have chronic diseases and illnesses. At the same time, we have to make sure that our nutrients are also healthy. We are eating things that are right and fit for our body. And the water also has to be like safe as well, not just drinking water for the sake of just drinking water, but water is very essential to our body. So that way, our body tissue is functioning correctly, and also is essential for the operation of many essential processes within our system. So those are some of the essential nutrients that comes from the food and the nutrition that we uptake or intake within our bodies. So why is nutrition good for us? Nutrition can help reduce the risk of some diseases, including heart disease, anemia, diabetes, stroke, some cancers, and osteoporosis. And oftentimes in the immigrant and refugee community, especially those who migrated from elsewhere from outside of the USA, a lot of the biggest concern that we found in public health is due to anemia. And anemia has to do with iron deficiency. I know a lot of the elders in the community also, suffer a lot with osteoporosis. They have muscle pains, walking issues, and things like that. But if they take the right, nutrition or nutritional supplements like calcium and all of those things, all these issues can be resolved. And really, good nutrition can have an impact on our life in the long term. And also, a lot of studies reported that eating the right food, having the right nutrition in the body, the right nutrients in your system, can also expand your lifespan, meaning you can live longer. Also reduces high blood pressure, lower high cholesterol, improve your well-being, improve your ability to fight off illnesses, improve your ability to recover from illness or injury. Also, it increases your energy level. That's why I know many of us sometimes in here right now are fasting. And I think we can experience it through Ramadan as well. When we don't eat all day, our focus and our energy level is not as productive when we have our, caffeine, or when we eat the right, maybe fruits early in the morning, or we eat cereal that is a whole grain. I wouldn't say coffee, I'm so sorry. That is a bad example to use now in this presentation. But if we eat fruits, cereal with that's a grain, a whole grain, made of whole grain, we drink with the 2% milk, we feel very productive throughout the day. And this is what it means when we talk about good nutrition. So how can we maintain a healthy lifestyle of eating to support healthy dietary patterns? Sometimes it's not just when you're going to the gym that you want to eat healthy food, but we have to really make this a tradition, make this as a lifestyle. It shouldn't be where 1 month you decide to be a vegetarian and you stop, or 1 month you decide to not eat a lot of red meat, then you go back to the original style of your eating. It has to be something that is constant, because it's part of our living, it's part of our health. And a lot of times I refer to the quote, health is wealth. And really, that is what we want to continue doing, keeping up with the patterns of our dietary intake. So I used this table here. The graph, as you can see, is my healthy eating plate. I actually got from Harvard website, and also this is something that USDA recommends. If you don't know like where to start to help you keep up with your eating, with your healthy eating patterns, then you can look at this healthy eating plate, which you can see is divided into 4 vegetables. The more veggies, and the greater one, or maybe the more greener, the more less, not overcooked, but less cooked. Like I'm from Somalia, and we overcook our vegetables, and that kills all the nutrients that we need to have it in our system. So when I talk about vegetables also, like as you can see in the graph, it does not mean eating French fries from McDonald's. You have to eat really vegetables that can help you retain the nutrients that you need for your body. Also fruits are a big part of the healthy eating habit. Eat plenty of fruits of all colors, like diverse, whole grains. I know we like to eat a lot of pasta, rice, a lot of chapatis, or maybe naans, I would say. Sometimes they are white flours, they are not whole grain. But when we say whole grain, you have to eat, things that are made with like wheat and things like that, and healthy proteins like fish, beans. Protein doesn't necessarily have to be just the red meat. It can be also beans, nuts. It can come from all sort of healthy other food option. And also when it comes to oil, we want to use healthy oils like olive, canola oil. All of these things are very helpful. It will help us avoid trans fat. And this is just some things that is the example. The food plate is just an example that can help us promote a healthy eating routine. It's important at every stage of life. It can have a positive effect that add up over time. It's also important, like I mentioned, to make every bite count. is very important. Every bite should count. It shouldn't be just something that, you're doing it like for the sake of just doing it, but you have to take it into like full consideration, and you have to be aware. It also means that you can become more aware of your health when you decide to take these approaches that are good for us. Another helpful tip or guiding standard is that the food label. A lot of nutritionists recommend reading the food label in case you're kind of confused about what, if you're taking the right diet, if you're balancing your food intake. Always, me personally, as Mona, I always try to read my nutrition facts. Like, I personally had issues with anemia, and I think it's very common about among a lot of girls from my background or in my community. So I have anemia, and I always, whenever I buy something and I look at the nutrition fact and I say, does this have iron, and how much iron does he have? And also what the nutrition label helps me do is that I can also select things that have like higher iron daily value. Like now in this example, you can see iron is only 4%, but in the daily value, they recommend that the higher the daily value, as you can see in the slide, 20% or more is very high. So the good nutrients, we want to go for the high ones. We don't want to go for the low ones. 5% or less is low as per the USDA guidance. So always focus on the nutrition facts. Many people start by reading the serving size, 1 cup, 2 cup, and things like that. Like if you take maybe 1 can of fruit, you ate 1 cup. But if you take 2 can of that fruit, then you took like 2 cups of canned fruit. So it's also very important that we know the balance of the food we are eating, because as I mentioned here, is basically divided into like 4 categories, and you see vegetable is dominating of what we should eat the most. So this is similar. We want to make sure whatever we are eating, we are requiring, we are maintaining the right nutritional benefit for our health. And then also in the label, you can see there's a comment saying limit these nutrients. So in the label, we have the good nutrients and we have the bad nutrients, right? So now like sodium, we all know sodium is not good for us. It's like salt and all of these things, cholesterol. We know a lot of fat's not good for us. But when you look at this label now, the highest daily value is among the unhealthy nutrients. Like look, sodium alone, 470 milligram, which is equal to 20%. So it's very important that we try to avoid food that have a lot of or that are higher in bad nutrients. And this is basically making sure that you're reading your daily value percentage. These are very important numbers, information for us to balance our dietary pattern. Any question? Okay. So I know sometimes it's very challenging when it comes to nutrition and different cultures, different communities, different population. But it's very important that we customize and enjoy nutrient-dense food and privilege choices to reflect personal preferences, cultural traditions, and budgetary consideration. Limit food and privilege higher in added sugars, strated fat, and sodium, as mentioned before. So in the previous slide, I talked about generally just a brief overview about food and nutrition and the benefit it has. So the second part, let's talk about who can access this food and where is the gap of food insecurity and who is affecting food insecurity and how it contributes to the overall health outcome of the population. So food insecurity and lack of access to affordable, nutritious food is a major concern in the US and are associated with increased risk for multiple chronic health conditions, such as diabetes, as I mentioned earlier, obesity, heart disease, mental health disorders, and other chronic diseases. When we say mental health disorders, some people have eating disorders. Some people, when they're sad, they don't want to eat, and it affects their dietary. So in 2020, there was a recent report from the USDA. In 2020, almost 15% of U.S. households were considered food insecure at some point in time, meaning not all household members were able to access enough food to support active, healthy lifestyle. So food insecurity also disproportionately affects persons from racial and ethnic minority and socially economically disadvantaged population. So healthy food accessibility and insecurity is also part of the social determinant of health. I know a lot of you guys are familiar with the SDOH, the social determinant of health, which is the education status, the economic status, the environment, all of that, the social level also. So let's look at how social determinant of health affects food insecurity and food accessibility. So food and nutrition insecurity are predominantly influenced by the local environment, including surrounding neighborhood infrastructure, accessibility, and affordability barriers. Access to grocery stores that carry healthy food options such as fresh fruit, vegetables, low-fat fish, and other meat are not located equitably across residential and regional areas in the United States. And this is now when we talk about the environment and the accessibility barriers. So now also let's look at the interconnection between food and migration, as it could be perhaps relevant to the New Maintenance Public Health Initiative, as a lot of the advocacy work is connected to empowering marginalized community in this advocacy work, or in this effort of food accessibility, nutrition, education, and so forth. So immigrants and refugees from low-income countries moving to high-income countries experience a lot of change from a more traditional food environment to a modern and industrialized one. And over time, they suffer from higher rates of many negative health outcomes, including obesity, type 2 diabetes, and other diet and metabolism related to chronic diseases, especially oftentimes at younger age, because usually the older people are still cooking from home. They still favor prefer like home cooking food more than buying a lot of junk food and things like that. But the young people from these marginalized communities are at greater risk. So then, as a result, these are the changes that occur basically in the social and environment structure. The social can mean like a lot of youths that are going to public schools or schools in general, and they're influenced by their peers and things like that. An environment, as we discussed about the locations and everything. And so this then includes a lack of time. A lot of immigrants or hard workers, they are working in factory jobs, construction jobs, jobs that require them to really, spend a lot of, basically, sorry, I think my thing, I don't know why it's acting weird. Okay, yeah, so immigrants, when I say immigrants in construction jobs or warehouses, it takes a lot of time from them. They are prioritizing other things. And this creates then lack of time, lack of social relations, even to engage in interventions that are promoting the uptake of healthy eating or a nutritional lifestyle. They have more stress, as many of them still have to care for their families back home. Children preferences, as I mentioned earlier, children preferring basically more of the modern and Western food over I wouldn't say Western, but like more of modern and industrialized food over traditional food. And then also this means this also relates to lack of access to traditional food, leading to having a less healthy lifestyle after migrating. Everybody's not very privileged of having access to. I know a lot of people, like for the Muslim community, they have to eat halal food. So like sometimes they don't have access to those traditional foods, or there's, some specific culture, eating style that they have, and those things are not available. So all of these things can then contribute to access barrier. So as addressed, due to the socioeconomic circumstances and food access, a lot of these immigrants then have to prioritize, as I mentioned earlier, rent and utilities over other things such as like food, having the right food in place and things like that. And likewise, they also, food was also prioritized over health and other costs. And low incomes were also centrally linked to food insecurity, and food decisions are majorly impacted by income. So a lot of the choices, even like, as we all know, organic food is more expensive than non-organic food. So sometimes income also can influence the lack of control of our food choices. So then also areas that lack access to affordable and healthy foods are known as food desert in public health terminology. And what this means is that, food deserts are usually found in urban or suburban neighborhoods that lack grocery stores like supermarket or small grocery stores that offer healthy food option, right? Found in rural areas in neighborhoods where the nearest grocery stores are too far away to be convenient or accessible. It's usually more prevalent in neighborhoods that are compromised over majority of racial and ethnic minority residents, and more likely found in areas with a higher percentage of residents experiencing poverty, regardless of urban or rural destination. Like I remember when I was new to America, growing up in my community, like the nearest store we had was like Bickley Weekly, Dollar General. And most of the time, those things are good for like if you want to buy household products or other, just house supplies. But I also realized that a lot of the youths were able to quickly walk there and buy like hot Cheetos, buy a lot of junk food. So these are all examples of what it means food desert. Food desert does not mean there is no food. There's no food sometimes. It just means also sometimes that the options we have is very limited. Because right now, I think many of us know about it. I don't know, especially in my state here or city, Nashville, Tennessee, a lot of the higher income communities now, we all have communities where it compromises majority high income population. They have the whole food market. The whole food market have a lot of healthy option, a lot of nutritional food products and all of that. But that is not the case. I don't think you will rarely find a whole food market and low-income communities or racial and ethnic minority communities. And sometimes this is all are in the buckle of food desert issues. So urban, suburban, and rural areas can also be overwhelmed with the stores that sell unhealthy, calorie dense and inexpensive junk foods, as I was mentioning earlier, including soda, snacks, and other high sugar foods. And this is known as a food swamp in the public health terminology. And then contributes then to the reduction or reduces access to nutritional foods and provide easier access to unhealthy food. And this is also a predictor of obesity, particularly in community where residents have limited access to their own or public transportation and experience the greatest income inequality. So what can we do to address food insecurity and access? Reducing food and nutrition insecurity in the US will require a multifaceted approach collective efforts that considers among other possibilities. Some of the strategies include, I will use the Numenes Public Health Initiative as an example, which is what they're doing right now. This is a great example of what it means, strategies that can engage communities in local health programs, creating awareness, educating the community about such concerns. Also uptaking interventions that utilizes federal food and nutritional supplement programs, including SNAP, the Supplemental Nutrition Assistance Program, and also the Special Supplemental Nutritional Program for women and infant children, because when they utilize such services, they also get some sort of nutritional service education as well. And they get to participate in those programs to help them increase their healthy lifestyle eating. And also, I don't know if you guys remember, there was some time back in, I think it was just recent years, there was a lot of advocacy around increasing tax sales on alcohol and tobacco. And this can be done or lobbied the same for unhealthy foods, to address the issue of food safety, food insecurity, and all of this thing, which means basically leveraging local and federal policies targeting food insecurity. For example, retail store intervention, similar to the alcohol and tobacco increased sales that I was talking about, where healthy food placement can be promoted or urged for retail stores to stock. Also, promotion and price influence on healthier choices, and sweetened privilege taxes to reduce the purchase appeal to consumers, and junk food taxes balanced with removal of taxes on, like, we can remove taxes on water and fruits and vegetable, because I don't understand why our society have to make healthy food expensive and junky food cheap. And now, because of the socioeconomic demographic background, it's just people have no choice but to go for this junk food, where I don't know if you guys have Save a Lot. It's different than Kroger. Kroger have option for at least organic food and things like that, where I rarely see organic food or organic vegetables or fruits at Save a Lot, as well as Aldi. So also where we go have different options of what we can buy to feed our body that will help us have the right nutrients and the right food to supply our body in a healthy way. And also, studies show these programs may also reduce food insecurity as well, because a lot of women and children from low-income background, they get vouchers, they get food stamp, and this is the government strategy to reduce food insecurity and improve food access. Thank you. That's all I have.
Mohammed will be discussing around discussion on of the barriers to accessing healthy and affordable food options, including cost, lack of transportation, and limited access to grocery stores in specific communities. Overview of effective strategies for increasing access to healthy food options, including community gardens, food bank, and farmers markets. A presentation on the role of government and community-based organizations in promoting access to healthy and affordable food options. Ibrahim Mohammed, the floor is yours.
Hello, guys. My name is Ibrahim Mohammed, and I'm a programs director for SLRO. And then, one of our programs is really trying to get the community to really know what food security is, and how to deal with it, and nutrition as well. So it's like, the thing is, in our community, really, when we talk about this, it's like they're kind of hesitant to change the way they already eat. So that's one of the first things that we need to tackle, and improving access to it. Not only that, we need to make them more or less hesitant, be like, okay, because some of them, they came from back home eating a certain way for so long, and then when they come here now, that like they do, I guess you can say, when they came here, they didn't really have the information now that community-based organizations are giving, because lack of community-based organizations back then. So when they didn't have this information available to them about eating healthy or ways to cook healthy, they just did what they can afford, and then we've already talked about affordability being one of the reasons for food insecurity in the immigrant community. So that being said, for so long, they were just used to cooking, white basmati rice, frying chicken, using vegetable oil, in their everyday meals, and then cooking pasta, thinking that's healthy, but little do they know that carbs are not so good for them, and not even vegetable oil is bad, but they don't know that it has the word vegetable, so they're thinking, it's cool, So first, it's educating them, and then the second thing is, how do we remove that hesitancy? Because like, if I've been cooking the same type of rice for 15 plus years for my family, and they enjoy it, and it's my kids' favorite meals, my friends' favorite meals, I'm not gonna one day be like, someone's gonna come to me and give me all this information. I'm not gonna be like, all right, I'm gonna drop what I've been doing for the past 15 plus years just because now I found out, oh, there's a healthy where it's an unhealthy. And the other thing is, like, once we do provide this information, sometimes they'll be like, okay, yeah, but it's not that serious. At the end of the day, I'm eating, it's not going to kill me. But little do they know, like, from eating this way, it can create chronic diseases. Like, for example, my aunt, she has diabetes now, right? And then she's in her 40s. And one of the things is, she didn't even know she had it, or how she got it. And once we went to the doctor, I'm translating for her, and she's just like, the foods that she eats on a daily basis that she lists and what led up to it. And then she's like, oh, wow, I did not know that was bad, And then another example is the same with my grandma. I go to the doctors with her, translate, and then they tell her, hey, you're close to getting diabetes. If you keep eating what you eat, then you're gonna get it. And then one of the main things that she listed was having shah, or tea with sugar, the Somali shah, so it includes tea, sugar, milk, lots of sugar a lot of times. So she was like, and then they told her, hey, you're gonna have to not drink that every morning or the middle of the day or evening. And then she's like, that's something I've been doing for my whole life, basically. She's like, I'm almost 70 and you guys are not gonna like tell me to change that up. Like, this is something I'm used to, And then she's to the doctor, she's like, what if I stop telling you to drink coffee all of a sudden, or stop having it the way you do, And then so me and my aunt, who's also her caretaker, try to like kind of convince her to not drink as much, because diabetes can be serious. And that's one of the things they don't realize sometimes, that diabetes is a serious disease. They're like they'll be like, hey, basically meaning like, if it's not like prevalent, if it's not like cancer, it's not something that can like kill me or is making me ill right away, I'm not gonna take as serious, So that's the other thing, maybe them being educated on how serious diabetes and these other diseases that you don't see, or that aren't just, right away making you ill or physically ill yet, can be dangerous. So a way to get to her was like, just kind of, telling her, okay, you can have the tea the way it is, just lower the sugar, and then from that go to no sugar, So like kind of baby steps. And then that's what we need to do. We need to take baby steps in our communities to them having more access to like healthy and affordable food. And then once that education, because education is key, once we give them that education, then surely and slowly kind of integrate them into that, because they're not all at once going to drop how they've been cooking for years to just this new way or healthier choice. So that's one thing I would say. And the other thing is, and now, we do have a lot of people in our community that back home are farmers. So when they came here, they started farming, and they eat a little bit healthier because they're growing their own, produce, their own vegetables and stuff. So it's more organic. So they're eating more organically. So that one's a good way, to having access to healthy and affordable food options. You're a farmer yourself. You're growing these vegetables. So when you're told, okay, hey, you should eat more healthy, you're like, oh, okay, all right, I'm already growing this and that, so I'm gonna do that. So that's a good example. But yeah, and then like the other barriers besides that, like we said, and Muna already touched up on it, it's the lack of transportation, like having healthy stores that deliver healthy or nutritional foods farther away. I think Walmart is like the biggest store that we go to, and sometimes Walmart has a mix of things, but like if we had more healthier stores closer to us, that are walkable or close enough to drive to, then maybe that having that access could change things, and sometimes healthy food is expensive, so maybe if we found a way, like Amuna already touched on this a little bit because we're talking about the same subject, but yeah, maybe the taxing and all of that, if that was lifted and healthy food was more affordable, that could be enticing to people, so yeah, and another thing, I guess, yeah, and then another way to like kind of overcome this, like community gardens, that's a great example. If we could have those, that would be another way to be like, okay, hey, if there's a garden here and as a community you're growing something, you're more likely to have it, and then that's another way to have access to it. So that'd be a great way to like changing that habit as well. So what else? So, and then the role, and yeah, and the other thing, these community-based organizations that we have right now, like, great, it's great that we have a lot of them in Maine now that are like out there educating people, doing community outreach, going house to house. Language barriers, another one, and then to have people that look like you give you information and translate to you're more trusting, you're like, okay, if this person looks like me, talks like me, and they're telling me something is good for me, I'm gonna trust that person if it's a friend or a coworker or someone that I know. So so I think it's one of the bigger positives is having these non-profit organizations, community-based organizations that are by us out there, because we know how our people are or what they've been through or what they struggle with, and if we can come in and support them in this way, then I think that'd go a long way. So and this is a perfect like example, this National Health Week that NMPHI is doing, that's a great way to kind of start. And if we can do this educational sessions on a larger scale or more, I think that'd be a perfect way to kind of tackle this obstacle.
Thank you so much, Muhammad Ali and Ibrahim. I think Ibrahim really highlighted all the important elements of, to a, I would say, in the, a perspective of our community. I know it's very challenging and we have a long way to go. Like he mentioned, baby step is the way to begin. And with time, then, we can have a very established programs and interventions that can really support our communities. It will reach a time where they will be the ones coming to us, to get assistance in how they can uplift their healthy eating practice and things like that. But sometimes also, I want to kind of go back to, I don't know who asked me this question. I think it was Gracia or Zakia, in terms of like how we can bridge the gap of what we are seeing in nutrition issues and food insecurity and things like that. Maybe, I don't know if the Numenes Public Health Initiative is already doing this, but one thing we can implement is like fellowship. Sometimes we are already ambassadors of our community, but having fellows that are kind of returning this information back to their own community, such as the community health workers. I think Hayat is already a community health worker here and many others here. I think it starts with our own family. Just let me come down to the bottom. It starts with our own family. Each one of us here have a responsibility to report whatever we learn today, to report it back to our family. And it's not sometimes making a bigger impact, but it's making those small impacts that then later on turns into a bigger impact. So just kind of also start with your family. When you empower one family, then you empower second family, then it then turns into a village to a community. And I think that is how solution begins. That's how change begins. Taking those baby steps, like Ibrahim mentioned. I don't have any other further comments to add, but I would take any question that you guys may have.
Yeah, I do have one question. Is farming? I know there is a great deal of farming that new Mainers are involved, especially in Maine. Are those farming changing the habit, the access to food, healthy food in the community?
Yeah, I believe so, because having these farmers here kind of like, it would make it more accessible for families that wouldn't like go out of their way to get maybe organic vegetables or food. Knowing someone that farms, a family or a friend, it'll be an easier access. And these farmers are out there marketing their food, be like, hey, I grew this and this at my farm. You can come purchase it. And if it's a friend, you'll be like, you know what, I'm gonna buy this vegetable from you to support you, or since it's accessible to you and someone that has, and now you're like, okay, all right, I'm gonna purchase it. So farmers are definitely helping increase food security and nutrition. I think that's one of the positives in our community. In Maine, like, we have a lot of farmers that are helping this. And then I know one of the programs, as a program director SLRO, that we help is the Sukan Somali food truck. And that food truck is worker owned by Somali immigrant women. And most of them are actually farmers. And what they do is farm to table food. So the ingredients that they use in their sambusas, is the vegetables are actually from their own farm. They grow their own vegetables there, and then they add into the sambusa. So it's like more organic vegetables in the sambusa. So now you're eating a more healthier sambusa than, let's say, the one you would buy at a Somali store. So that's the way that they're improving, access to healthier foods or a meal. Yeah.